I would say I feel better now in my 30s than I did in my 20s because I felt like in my 20s, I was so inflamed. I was tired all the time. I remember I would drink caffeine all day to get through the day, come home and just sit in my car because I was too tired to even get out of my car.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Today on the podcast, I have Laura, who is a compounding and functional medicine pharmacist at Service Drugs here in Ridgeland, Mississippi. She specializes in gut health, hormones, mold, and parasites. And her goal is really to teach people that diet and lifestyle are the foundations to health and that you can heal from chronic illness. I met Laura and knew that we would connect instantly. And so we went and had coffee and had just an awesome conversation all about functional medicine. It's exciting to connect with somebody else in the functional medicine realm, especially who's a pharmacist. I don't know anybody else that's a pharmacist that's interested in functional medicine. So that's just exciting. I really would love it if you told our listeners a little bit more about what you do and what got you into this role.
Okay. Well, thank you, Allison, for having me. Yeah, we connected and it's always nerve-wracking to meet new people, but I felt like we kind of instantly connected and it was really awesome. And functional medicine in where we live is a tight community because there's not a whole lot of us. It's growing, which is exciting. But I started out as just a regular retail pharmacist working at a chain and then eventually got into compounding, which is what I do now. And so compounding, we're just custom making medication for people and we do a lot of bioidentical hormone. And through that, I was kind of learning about functional medicine, but at the time it didn't even process that that's what I was learning because it was so outside of my radar. And then I got online, found some people that were talking about non-toxic living, and I just was interested in that and started getting into that for myself. And then came across more people online that were, I'm a functional medicine this or that. And I found a functional medicine pharmacist and I thought, oh, that's so interesting. Like, are you just calling yourself that or did you do training? And so she kind of told me, no, there's training you do. So everything that you and I do as far as functional medicine is beyond our degrees. It's additional training, but I feel like I've learned so much more than I even learned in school. And it's just a total mindset shift, a total different way of looking at things than what we are taught traditionally.
Yeah. One of the things that I loved about functional medicine that you made me think of is just how applicable it can be to your personal life and your work life. I know for you, non toxic living has been a big thing. Let me ask you, I really am interested to know. There are so many medications that I know people are put on long term. How can we really address these side effects of these medications?
Yeah. In school, it's just information overload. So you're learning about the side effects, but for pretty much every drug, there's a handful of side effects that you kind of just get to be where it's like, like nausea, headaches, and you're like, okay, that's not even a thing because it says that for every drug. So you almost just get numb to the fact that these side effects are real. So unless it's something severe, then you almost just kind of push these side effects to the wayside. We don't even get educated that these drugs induce nutrient depletions. And so it may not be an immediate side effect that you're seeing. It's going to be something that you're going to see down the road and people aren't even correlating it. So the best example I have would be all of these acid blocking drugs. So the proton pump inhibitors, it's kind of a hot button topic in functional medicine, but it's a real thing. If you look at the package insert, it says for no more than, I think, 4 to 8 weeks at a maximum. They were never meant to be long term medications. They were meant to help you heal an ulcer if you have an ulcer and then stopped. And they got put over the counter. People got put on them long term. And nobody's talking about the fact that they cause bone fractures and they induce multiple nutrient depletion. So you're not going to absorb B vitamins, iron, magnesium, and your stomach acid is there for a reason. People don't realize when they've been on them for 2 years and now they've got fatigue and they've got hormone issues that it's actually related to the fact that you're not absorbing any of your nutrients now. And nobody's putting two and two together. And so it's a huge problem. People are just not being educated on these things. And it's no one's fault. It's just that we're so worried about these grand side effects that we're not acknowledging the really, really important small ones.
Yeah, I can agree with that too. And I think, like you said, I don't think it's anybody's fault. However, I think that just society as a whole, the health industry as a whole, we're in such a hurry for everything. And providers aren't spending enough time with their patients to see if they maybe need to get off of that medication, or if they're interested in getting off that medication, or if they're experiencing some of those subtle over long term type side effects. I see a lot of people who have tried to get off of certain medications like this and they'll stop them cold turkey. And you can't do that. You've got to wean yourself off of them appropriately. But at the same time, they've never been told that. And they think that when they stop it, that because of the rebound effect that it has, that, oh, they really need it because they started having this acid indigestion issue really bad without it. Well, of course they did. If they've been taking it for years and then all of a sudden they stop, that's what's gonna happen. So, I think just people being informed and being educated before they take certain medications is what's important, and I tell people this all the time too, like, me as a person, I am not against medications by any means, but I think that if you're gonna choose to be on a long-term prescription medication or even supplement, whatever you're taking, you should know the pros and cons, and if you decide, if you're informed and make that decision to still be on it, then at least you're making your decision. I think that just being your own advocate is so important. I also want to
Right.
ask you, Laura, what are some common health aspects or issues that you, as a functional medicine pharmacist, frequently observe being overlooked in traditional healthcare?
Oh, goodness. Well, I think that a lot of the root cause stuff, the symptoms can be so vague that these band-aids just get slapped. You're having anxiety or depression, you get put on an anxiety or depression medicine. You're having hormone issues. If you're, premenopausal, you get on birth control to just shut that system down. So I think it's not necessarily any specific condition that's getting overlooked. It's just that we're so reactive that instead of saying, well, hey, you're having anxiety maybe because you don't have any stomach acid and you don't have any B vitamins. And so you're nutrient depleted and that's triggering the anxiety. I think we don't take a step back. We just react. So I think that we get put on these medications that a lot of times, if we just addressed inflammation, stress, and diet, all of those root things, because we just live in a very hectic society. I think stress is one of the things that gets glazed over because when I'll ask people, what's your stress level? Oh, well, it's not that bad. But then you start digging deeper and it's, I work full time, I have kids, I'm taking care of my parents. And so that's just the norm to them. Getting 5 hours of sleep and never having a moment to rest, that's normal. And they're managing it, they're functioning, but maybe not well, but it's their norm. And stress as a root cause is a big deal. It's going to eat up all your magnesium and vitamin C levels. It's going to decrease your stomach acid. It's going to let you not sleep well so your body can't regenerate and heal. So I think we really overlook stress as a major player as a root cause. And that's a tough one because there's a lot of those things you can't remove. You can't say, I'm not going to take care of my kids and my parents and all of those things. I'm not going to go to work. So it's learning to help people manage that and find coping mechanisms that I think is a really important factor in preventing people from healing.
Yeah, I agree with all of that. I think that a lot of times the healthcare system, the way that providers are trained, it's very much on managing diseases and disease processes and conditions. It's not so much about healing. I think that that's what it's turned into. I truly do, because you go to school and you learn about a disease or condition and what do you do about it. I don't think that it's anybody's fault, but people are trained in healthcare to learn about this disease process and what medication to give the person. And I think a lot of it too is because people want fast results. I mean, who
Oh,
doesn't,
yeah.
right? They want a
Yeah.
quick fix. But what's really important though is what's sustainable. There's not a quick fix that is going to be sustainable. People need to know that there are other options, that if you truly want to get past all of that and heal and have a long, sustainable, healthy life, that some of these quick fixes are just not the answer, right?
Yeah. Neither of us is saying medication is a bad thing. And a lot of times it's necessary. If you're having an acute autoimmune disease and your joints are under attack, you need to stop that process. And healing is going to take time. So, maybe you need to take a prescription medication in the interim, but long term, what's that going to look like? So, there's no shame or issue or problem with taking a medication. It's just we need to look at, okay, let's get this under control while we look at what's causing this inflammation in your body. How can we fix your diet? How can we fix your lifestyle? What's driving that inflammation in the first place? But let's take this medication so that we can save your joint while we work on those other things. Use the tools that are available to you. Medications are available, and that's a great thing. But it's just that we have to acknowledge that if you are on medication long term, there are going to be consequences. Most people aren't on just one medication because if you stay on a medication, you're going to need another medication to treat those side effects. I think a really great example of that is cholesterol medications. Tons of people are on statins and nobody's telling them that there's a physiologic process in your body that's being blocked. And when you use a medication, it's not like with diet where there's like an ebb and flow and a balance. So if you're on a statin, you should be on CoQ10. And somehow along the way, that doesn't always get communicated. And then you're going to have mitochondrial dysfunction. And mitochondrial dysfunction can manifest in fatigue or other body areas are going to shut down. Acknowledging the fact that medications are wonderful, but we need to be honest about the fact that long term, there are issues with shutting down a process in the body. That's just the balance that we have to find.
Yes, yes, I agree completely. Let me ask you, what are some of the most frequently prescribed class of medications that you
Yeah.
see here in our area?
Well, I'm a little bit outside of that realm just because I work strictly in compounding, but I think definitely in where we live, diabetes is a big issue. So I would say those medications, I think statins and PPIs that we've already talked about are some of the top prescribed medicines in general. But I would say here, diabetes is another major player, which is, is diet and lifestyle driven. Definitely something that can be controlled. So it's a big problem.
Yeah. Laura, from your perspective, why do you think functional medicine is important and how is it different than traditional medicine?
I think traditional medicine is really great if you are having a crisis and a health emergency. So if you are about to die, our healthcare system is the best. You're not going to do better. Functional medicine is really about healing. We're not saying you can't be on a medication. That's not what functional medicine is. Functional medicine is looking at the whole body, at your whole history, and knowing that everything works together and trying to find balance. To me, the name of the game is inflammation because I think inflammation is the root of all chronic disease. And so to me, functional medicine is using your diet and your lifestyle to manage this inflammation. And when your inflammation is low, your blood sugar is balanced, then things just tend to fall into place. But the goal of functional medicine is to look at the body as a whole and to try to heal it versus just slapping a band-aid on a symptom.
Yes. And when you say inflammation, Explain a little bit more about what that means. Break that down for our listeners. A lot of people think of inflammation as just a flare up of their arthritis or if they've injured themselves, but that can mean so many different things, right?
Yeah, definitely. So inflammation is not bad. And this is another thing, I guess, yeah, that can be very confusing. Inflammation is good. If you have an injury, if you cut your finger, inflammation is what's going to allow all those white blood cells to come to heal that injury. It's the chronic, low, simmering inflammation long term that becomes an issue because inflammation should be a reaction and then it should turn off. And it's when that imbalance happens and we've got this long term, low grade simmering process that starts to damage our cells, that starts to cause this breakdown. And that inflammation can be from a lot of different things. It can be from poor diet, lack of sleep, working out too hard, infections. There's these endotoxins that can be released if there's an imbalance in the gut and it can cause a lot of inflammation. So toxins. There's a lot of things that cause inflammation. Inflammation isn't bad. It's when it becomes long term that it turns into a problem.
Right. And all the things that can influence that, I think you'll agree, are going to be diet, lifestyle, how you're treating your body, your environment, the toxins, the kind of chemicals that you're around. I would love for you to talk just a little bit more about the toxins in your environment. I think a lot of people don't realize how many chemicals or toxins surround them daily.
Yeah. I think that a lot of people will say, oh, well, I grew up with this and that and I was just fine. And the reality is that things have changed over the years. The way that our food supply is handled, the things that are sprayed on our foods, what's allowed in our water. We think it's safe, but it's about total load. And so it's what we're exposed to versus what we're able to clear. And the problem is we're exposed to more and more. So yeah, maybe that level that's in this one food or what's in your water is not necessarily dangerous, but it's there. And it's in 5, 10 things that you're interacting with every day. And that's where we get the problem. So yeah, the things that are sprayed on our crops, people throwing their medications away, that gets into our water supply and you're ingesting that. The unfortunate truth is that we have to be a lot more aware and careful about what we're introducing into our body because there's just a lot more that's out there that didn't used to be there even 10 years ago. So, filtering our water, organic when possible, or washing your produce, those are simple things that can really have a big impact for people.
Yeah. And you talked about disposing of medications. What is the proper way to get rid of your medications if you have expired medications?
So, some pharmacies, including our pharmacy, have bins that you can come put your medication in and it will go to a disposal facility where they will safely dispose of it. So, yeah, flushing it down the toilet, throwing it in the trash, that's not really the best way. So, if your pharmacy doesn't have something like that, usually cities will have a day every month or maybe every quarter where they do like bring back your expired medications. That's really the
Yeah.
safest way is to bring it somewhere that they can send it off to be disposed of properly.
Okay. Yeah, I think that's good. I think that that's something that, again, that people may not be aware of.
Yeah.
So, Laura, I know that you have a little bit of a gut health journey, and I would love for you to share a little bit more about what that looked like.
Yeah, so gut health was kind of my intro into all of functional medicine. It's a great starting point because the gut is the second brain. As long as I can remember, I had stomach issues and it was just kind of, it runs in the family. Our family has sensitive stomach. I mean, I can remember I had a lot of constipation issues as a child and then moving into high school, having a lot of the opposite.
Right.
A lot of anxiety, a lot of stomach burning, which looking back, like I remember waking up and drinking a Coke on an empty stomach, which I mean, my goodness, could you do anything worse? But into college, my stomach was always a point of anxiety. Like, is my stomach going to be messed up during this test? And it was just a norm for me to have stomach issues. That was just like a family trait. And I learned about gut testing. I was like, well, I feel like this is something I need because I've always had stomach issues. I had taken a probiotic and I was just like, oh, a probiotic fixes everything. And I had just picked up some generic probiotic, and it helped to an extent. Things were a little bit better, but I mean, a probiotic is not gonna be the full answer, and so when I did the gut testing, it was very crazy to learn that I had H. pylori, which is a bacterial infection of the stomach. We learned about it in school, but it was kinda one of those things that was like this, like, I don't wanna say, like, rare thing, but we didn't learn about it as if it was as common as it actually is, and you had to do this 4 medication treatment, and it was this, like, big ordeal and kinda like, "Oh my gosh, if you have that, wow, that's weird." So I actually had H. pylori. It was so interesting learning that about 60% of people have H. pylori, and it's super contagious, and what it actually does is, releases this enzyme called urease and lowers your stomach acid, and so that's gonna cause a lot of maldigestion. It's very inflammatory. It burrows into your stomach and kinda, like, rips it up and causes just so much inflammation, and so as I worked through healing that, which I did without prescriptions because you can very effectively, the difference in how I felt and, I don't have all this anxiety around my stomach anymore. That was really eye-opening for me. Like, wow, who knows how long I've had this infection. Finding that balance really decreased a lot of the inflammation that I had. I would say I feel better now in my 30s than I did in my 20s because I felt like in my 20s, I was so inflamed. I was tired all the time. I remember I would drink caffeine all day to get through the day, come home and just sit in my car because I was too tired to even get out of my car. And so it's just amazing what you can do by healing your gut and fixing your diet a little bit to drive that inflammation down, how much better you can feel. So yeah, if you don't know where to start, looking at your gut is always a good place to begin.
Yes. Yes, the gut is just connected to everything, and I never realized how closely related our stories were. I mean, just all the symptoms and everything and how it was a family trait, as you say,
Yeah.
just going so long with these stomach pains and being told that it's normal or thinking that it's normal, and I did not have H. pylori, but my pancreas was not secreting the appropriate digestive enzymes. So, not digesting your food properly, there can be so many different reasons for that. And you're never really going to know that and never really going to know exactly what's causing all that inflammation unless you do certain gut testing and try to find the root cause of it. Because there may have been so many things you could have done to just kind of mask the symptoms, but then you being in your 30s, maybe you still would have been, crashing in your car in the afternoon and having all this fatigue and just bloating and inflammation in your body, right?
Yeah.
It sounds like your quality of life definitely changed after you healed your gut.
Absolutely. And I think the biggest thing for people to kind of realize is that if you can't, if you're like, I'm on a budget, I can't do all this testing, like that sounds great, but I'm not in a place where I can do that. You can still work on things. So the biggest bang for your buck you're ever going to get is to clean up your diet, increase your fiber, increase all of the brightly colored fruits and vegetables, decrease processed foods. Start there. Try a high quality probiotic, don't just go grab one off the shelf, because it does make a difference. And just start there. Testing is definitely helpful if you can do it, but you don't have to test to be able to improve your gut.
Yes, and I think that that is something too where people need guidance sometimes. A lot of people, I know, including myself, might go so long with doing all these things. I went so long trying to eat the right foods, the right amount. I tracked my food. I ate the right amount of portions. I was gluten free, dairy free, and I also was working out a lot. I was doing all the right things, right? And I was still having certain issues. People might be skeptical because it is an investment up front, but I can say from personal experience, since I tested my gut and had healed my gut, I have not been sick over the long run. It has saved me so much money and time because I've gained so much of that time back because I'm not sleeping all day or fatigued or, spending extra money on all this coffee. I mean, sometimes for fun, right? But not because I can't function without the caffeine. And so for me, it just truly was life changing in that regard. I think just for my immune system. and everything. I
Yeah.
was thinking about it the other day, especially this time of year, a lot of people are getting sick. And I have not had to be sick or had to be put in any situation where I might possibly need any kind of antibiotic in 2 or 3 years. And that's just, I don't think that that's normal for a lot of people. I know a lot of people go to the doctor every time that they sneeze and think they need an antibiotic. And that's just not realistic, right?
Yeah. No, I totally agree. I mean, it's the mindset of like, I'm going to invest in my health. And, a lot of people don't bat an eye at eating out all the time or getting Botox, all of these things that really add up. Like, that's fine to spend your money on. But, oh, this testing for my health that my insurance doesn't cover, maybe and that's okay. Some people just aren't there yet, but I totally agree. It's an investment in yourself. And if you look at what you're going to save in the long run, if it's nothing other than time, I mean, time is so precious. And I agree. This season of cold and flu, we had multiple people at work with flu. Everyone that I work with had COVID, and I never got it. And I do think that's a testament to building up your immune system, keeping your inflammation under control, not eating a ton of sugar so that your immune system can handle it. And so that's not to say you're never going to feel a little bit under the weather, but the goal is that you know how to rest, nourish your body, and you're gonna bounce back a lot quicker, and not be nearly as sick as somebody who is not doing those things. So I agree. It's if you're ready to invest in yourself, I don't think you'll ever regret it.
Yeah, right. I agree completely. Well, Laura, this has been such an amazing episode. Are there any comments that you want to leave with our listeners today?
Well, thank you again for having me. It was so much fun. And yeah, the message that we're both trying to get out there is to empower yourself, educate yourself. You're going to be your own best healthcare provider. Nobody spends as much time in your body as you do. And so, if you are trying to figure out if you have unresolved symptoms, if you want to heal and you're not getting answers, just know that there are answers out there and keep searching until you find the right person to work with that can help you find those answers.
Yes, I agree. I love it. I want to emphasize too, if you don't know which way to go, you don't have to do it by yourself. There's people out there that you can learn from and not waste time trying to figure it all out yourself and have some
Yeah.
guidance with. Thank you so much for this today, Laura. It's been a good one.
Thanks, Allison. That was fun.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.